Hello everyone, welcome back. I'm Dr. Swati Gupta. I'm a periodontist in India and I'm a DMD from Boston University. And this is my channel, Board Aspirants. We coach people for INBD exams and also making these videos to help all the dentists out there or any educational video that can help anyone. So this video, we are going to talk about managing contracts. And so it's going to be useful for all the D4s who are going to be getting out there, finding a job, talking to employers about potential contracts, or dentists who are already out there in the field. So just watch this video if you like, share, and subscribe. Let's get started. The first important thing that I understood, and I've asked, and after talking to so many people with our faculties and everyone, the most important thing I feel in this is location. Why do I say location? Location is very important because when you move to a place, you're going to be settled in that place for at least a year or for 2 years. I mean, depends. If you have a family, you're not really going to move out, from one place to another. Even if you're alone, you're not going to be moving out that frequently. So what I think is that location is very important in terms of your commute. Now, some people don't mind a 2 hour commute every day or 1 hour commute every day. But being a dentist or a health professional, already your job is so demanding. So I do not feel that you should be like looking for a job that is like 1 hour away, 1 hour commute. Definitely a place that is closer to you is like 5 minutes a walk or 10 minutes a drive or 20 minutes drive. Now, when I chose I chose a place which was 20 minutes drive for me. The reason being 20 minutes is reasonable. I do not want to spend all the time in commuting, be tired by the time I go for the job, and then lose out all the money just on driving, right? Rather, I can be actually working, I can be making that money, that 1 hour that I spent on drive or 2 hours going and coming back again. So I just feel that location is very important. Now, location is also very important when you are taking a job with a clinic, or any organization that has multiple clinics. Okay, it could be a private clinic, it could be DSO, it could be DPOs, anything. It could be anything, but any such entity that has multiple clinics in that location or anywhere. The reason being, there is a term called restrictive covenant. Now, what is restrictive covenant? Restrictive covenant is meant to restrict you from working in a location nearby for confidentiality purposes, it restricts you for a period of time and within a particular radius. Now, let's take a random zip code. I was in Boston University, so let's take 02118. So supposing I was working at 02118 zip code in ABC clinic, and what they would do and if they have multiple clinics in that location or in that city, now their restrictive covenant will be dictating something like on the contract that you are not supposed to work within 5 miles radius of our location or of any of the locations of our entity. Now here's that's where you should be very careful. Our location, 5 miles radius, depending on where you are. If it's a small city, 5 miles radius is like really huge and you'll be out of the city if you're looking for another location. So definitely you cannot do 5 miles radius. But if it's a big city, then fine. Usually there are clinics, 5 miles radius, you'll find any other place. And 5 miles radius for a period of 1 year or 2 year, usually you go with a period of 1 year, if not maybe 2 years, but not more than that. And that's acceptable too. But if they tell you that you cannot, if their restrictive covenant says within any of our locations. So now, usually many clinics, many dental organizations, what they do is they do not change the name of the practices. When they buy them out, the name of the practice still stays the same. Now, since the name of the practice stays the same, like if imagine ABC bought another practice, okay, like Pricey Dental, and they did not change the name of that practice from Pricey Dental to ABC because ABC bought it. So you will never know that it is owned by ABC, right? And if you've not researched enough, you would not know. What will happen is that for some reason, if you break your contract and now you want to move to another location or maybe Price Dental, you never saw that, or maybe within 2 miles of Price Dental, right? But your contract said within 5 miles of each of the practices of this particular company or organization, here in our case ABC, then you are stuck. Because when the contract terminates and then you realize, oh, okay, this particular clinic, Price Dental, is also actually owned by ABC, and now 5 miles of that particular location I should be thinking of a job, I thought I can look in that other location because Pricey Dental was within 5 miles of ABC. you're getting my point. Yeah, this is where it gets very tricky, and this is very important for you to understand that you have to be very sure about different locations, or make sure that your clinic that you're going to work with, your organization that you're going to work with, where their locations are, and then talk about your restrictive covenant accordingly. Okay, so now you understand why I put it as a top most important thing, location. Second thing that's really important is the working hours and your pay. Now you can be paid by hourly, you can pay daily minimum guarantee. When you start out, usually any private clinic or organizations will offer you, okay, we can give you maybe for a 3 months minimum guarantee. Some will not offer you anything, some will directly just start you on productions and collections. Again, if you do not understand production or collection, watch my next video, and you will get an idea about productions and collections. But the point here is that you have to know how are they going to pay you. Okay, if they're going to pay you hourly, that's very tricky, because what happens is, it can happen in a clinic, it can happen in an organization, that when you do not have a patient, they might actually tell you, okay, fine, we're done for the day, we're closing at 2 because we are not don't have anything for you today, and you might be asked to go home. Now in your mind, you're working 8 hours a day, maybe at $110 or $100 an hour. So you are thinking, I'm supposed to get $800 a day. But here now, yes, you're not getting that, because it was never mentioned anywhere that if you patient doesn't come that day, you will still be paid $800, right? And you are going to be paid hourly. So that's a very tricky thing. Even a daily minimum could be tricky, because for whatever reason, if they don't want you to come today or something happens, are you going to get paid? I don't know. So you have to get everything in written. Okay, remember this. This is again a very important thing. Like, of if anything you want to remember from this video, anything very consequential that's going to affect your contract, is that unless and until anything is mentioned in written in your contract, it does not hold. Anything that was a verbal conversation between you and me, between you and the recruiter, you and the doctor, it was all verbal. Okay, you can go back again and say, oh, I had a conversation with you on the phone. No, who remembers? Have everything in written. Any doubt that you have, and anything that's not mentioned in your contract but the recruiter says, or the doctor says, we'll get it done, don't worry about it, no, give to me in written. Have it to me in written, so that we can go back to these records that you said we'll get it done. Okay, so this is very important when it comes to your getting paid. Okay, don't think about it that they are thinking I'll be a desperate, or no, we all have school loans to pay, we all have studied hard enough to make money. If you were going to work in a charitable organization, you would go to a charitable organization and do voluntary jobs on the weekends. But all of us need money. So this is a really important thing that you should not be ashamed to discuss about. How much am I going to get paid? What are my working hours? What if I'm not working? Am I sent back, or am still getting my daily hourly guarantee or a daily minimum guarantee? And what happens if my productions are falling? You need to have these conversations. Okay. Third important thing that I really think that's important is about your notice period. Now, why notice period is important? I mean, it's understandable. When we are joining a job, we don't want to leave it, right? We're not joining with the mindset that I'm going to leave within few months, or the things are going to be bad. We all want it a long term. But please do understand that bad things can happen. You might not get along with a dentist, or with the people there. Or also could happen that your production is not that great. You were told that you'll get so many patients in a day, but you're not. So why would you want to be there? You want to be in a place where you can grow. So notice period comes in that sometimes employers are going to tell you that, oh no, we want the notice period to be 4 to 5 months, right? Or 3 to 4 months at least, because we need to find a new dentist. You have to understand a position. Understood your position, but as an employee, it's important for me also that I am in a place, or I have a notice period which is favorable for me. Now, if I'm not making money in a clinic, or the people are not being nice to me or something, why would I stay in that place for it more than 2 months? Now 2 months is reasonable, right? You've given them 60 period, go and interview someone. It takes time to negotiate a contract, fine. You've given them 2 months, but you do not want to be extending that notice period to more than 2 months. 2 months, at least, actually, 1 month is good. But what I've seen is usually they will tell you at least 45 days or 2 months. Okay, fine, 2 months is fine, and should not extend more than 2 months. So notice period is really important. Another thing to look out for. Another one of the things that I feel is important when you're signing a contract is that you, before you even sign that contract, just don't go by what the recruiter said or by what the dental clinic, the doctor told you, regional doctor or the clinic. Go and actually go to that practice, okay? Shadow in that practice. Tell them, I'm not going to sign the contract until I start coming to the practice, maybe just once or twice a week. I just want to see how the working pattern is, how is everyone working. And then there, talk to everyone, talk to the assistants, see the behaviors, talk to the office manager, see how they're working. So talk to other dentists, talk to if they are specialists there or not, is everything. I'm telling you, there's a huge difference between sometimes with what the recruiter tells you and what you find when you go to the office. And then it's like that happened to me when I joined the practice, and what was told to me and what was there in the clinic, it was a complete opposite, right? And I'm telling you, it's not pleasant. It's not really pleasant, because you go with the impression of everything is fine, and recruiters purpose is just to sell out, right? They want someone to be recruited because that's how they make money. So they are going to give you a very rosy picture, but it might not be the same there. So you have to look out for yourself. So never sign a contract if you do not have the time, or for whatever reason you cannot go to that practice to visit it. Don't sign the contract. Don't put yourself in a position where you have to start thinking about leaving that position within a month or two, and you have a notice period that says 2 months. Okay, it's not easy. So always visit the practice first. Talk to everyone, talk to every dentist there, talk to every specialist there, talk to dental assistant there, talk to office manager, see their working style. If you are comfortable with everything, then only sign the contract, never ever before. And another thing is very important is what is expected of you, because sometimes, again, because the clinician will tell you, or the main dentist and will tell you, or the organization head will tell you that you can do anything. What is expected of you is these particular procedures. But then when you go there, again the point of why you should be visiting an office is because they will tell you that you can do anything, right? And expected of you is to do everything. But understand that most of the dentistry in the US is kind of an insurance driven also, right? Because you see what the patient's insurance is going to pay. The patients also cannot pay out of pocket all the time, so they also see what their insurance can cover. So that kind of changes your treatment plan. Okay, I'm not saying it changes your treatment plan. What I'm saying is in terms of who will do the procedure, right? If it's a procedure, if the procedures in a particular clinic are done mostly by the specialist, by an endodontist, by an oral surgeon, then you might not have the chance to do those procedures. But if you're the solo general dentist and other specialists come on irregular days, then it might be easy for you to do, right? So what I'm trying to tell you here is that know what is expected of you, again, by visiting the practice, not just by the word of mouth of the recruiter or anyone that you can do everything. Because again, it's not like that. It's not like they will allow you to do everything. Sometimes they know what the office managers will dictate, what procedures you can do as a general dentist and what procedures their specialists do, because of insurance reason. It has happened, okay? With me, it has happened to my friends. So I'm telling you, this is a big red flag also. So visit the practice. Another important thing that is very important is your understand who's the in the chain of commands, how easy it is to talk to everyone. So initially when you're signing a contract, mostly the person you'll be talking to is just the recruiter, and they're very pleasant, okay? They know how to get you in. It's very easy. But once you sign the contract, then it's not just the recruiter, okay? Then there's 100 people in that chain of command that you have to talk to figure out, when am I starting, do you need my license number? Like these days, what is happening is that the practices, like I don't know, clinical practice or a DSO or anyone will tell you that we want you to actually shadow, okay? Shadow for 2 weeks when you join. Now that's not mentioned. It was when I started, it was never mentioned to me that you'll be shadowing for 2 weeks, and I was like, why was it not mentioned by the recruiter? All I was told was that I would be working directly when I get my license, but that's not how it was. And these shadowing sometimes are not even paid. So you started joining a practice and you're not even getting paid. So again, a big red flag. Don't forget to ask the clinic or the DSO or anything that you're joining. Ask them, are you going to have me shadow? So I hope you've understood some very important points from my video: location, covenants, notice periods, pay, work hours, and very important, are you asking me to shadow? Okay, be clear of whatever you want to ask them. And in terms of what is a DSO or restrictive covenants, be look on the lookout for my next video. Have a good day.